Hello, my name is Ashley Handback. I'm an RN in the BSN program at Troy University. Today we will be assessing head to toe and interviewing my 31-year-old male client here. Sir, we will be videoing this assessment. I'll be going through some questions with you, examining you. I will do my best to provide the most modesty possible. Doing a general survey of the patient, he appears his stated age of a 31-year-old male, his level of consciousness, he is awake, alert, fully oriented. His skin color is pink undertones with good turgor that's appropriate for race. His positioning seems appropriate for age. No difficulty in mobility, no physical deformities noted. Facial expression is appropriate, and his only complaint today is back pain. He does appear his stated height of 5.58, and his weight of 214. Prior to beginning this, we would have performed hand hygiene, placed the patient in a gown, obtained vital signs. And we'll go ahead and begin our head-to-toe assessment, starting with the patient's head. Sir, I'm going to place my hands on you now. We would begin by examining the head. Patient has brown, evenly dispersed hair. If you'll lean your head up just a little bit. I see no lesions, no masses, bumps, deformities noted to the head. Assessing his skin, all the skin on his head seems intact, as well as his face. Next, we'll move and assess his vision. In a clinical setting, the patient would have had a visual acuity test done at 20 feet away from him. This patient does get a routine checkup at the eye doctor every 6 months. He has no correctional lenses needed. His vision is 20/20. Sir, I will examine your eyes now. I'm going to touch your face. Eye orbits appear well intact. The conjunctiva is clear and pink. The sclera is white. The cornea seems clear and smooth. His iris is flat, round with a brown coloration. Now we'll examine the pupils. Sir, if you'll take a look straight ahead at my hand here, I'll shine a bright light into both eyes. Take a look at my hand here. Bright light in the eyes. Each pupil appears reactive to light, rounded. Now we will assess his vision, and we'll start with peripheral vision first. Alright, sir. You can tell me when you see my hand here.
Yeah. Yep. Yeah. Yeah. Yeah.
We will continue examining the face. Facial margins appear normal. Sir, can you raise your eyebrows for me? And can you smile? Facial symmetry is even. And in a clinical setting, we would use an ophthalmic scope We don't have one of those here in the home setting, so we will continue on to the ears. Both external ears appear equal and even shape. Any tenderness to your ears, sir?
No.
Next, we will examine the ear canal, and we'll use a pen light in the home setting due to not having a scope. Any tenderness noted in your ears, sir?
No.
There was no drainage noted in the ear canal, no tenderness in either ears. Even symmetry noted to both ears. Now we will examine the mouth and the throat. Sir, if you could open your mouth for me and stick out your tongue and say ah. Good. Can you grit your teeth for me? Any concerns in your teeth that you're aware of?
No.
The patient's oral cavity is pink, moist. There is even dispersion of his teeth. Teeth are white, intact. His gum lines are pink, moist. I notice no lesions, no abnormalities in his mouth. His tonsils are visible and pink. His uvula is pink and midline. His tongue is also midline with no deviation. We will continue our examination onto the patient's neck. And upon examination of his neck, his trachea does appear midline. I'm going to touch it. There is no tenderness noted in the patient's trachea. We will examine for lymph nodes. There are small lymph nodes that are movable. Sir, were there any tenderness noted upon palpation of your neck?
No.
And no tenderness noted in the lymph nodes. Next, we will examine for a carotid pulse. The carotid pulse is present and even on both sides, easily palpable. Next, we will examine for jugular vein distension. Sir, if you'll look your head that way for me a little bit. Okay, now we'll examine the other side. There is no jugular vein distension noted on either side of the patient's neck. Now we will continue examination for range of motion. Sir, if you could sit up just a little bit, and if you could move your neck from side to side, and then front and back. There are no difficulties with range of motion in the neck. Was there any tenderness, sir, when you were moving?
No.
Okay, you can rest back. Next, we will examine for the thyroid. And we're unable to palpate the thyroid. Next, we'll move our assessment on to the chest and the lung area. Due to patient privacy, the patient has requested to leave on his t-shirt, so we will not be examining from skin, but in a regular clinical setting, we would examine the patient's skin. Upon examination of his chest, it does appear symmetrical and even. The patient has no complaints in his chest and lung area. If the patient weren't wearing a shirt, we would notice that his chest was pink, the skin was intact, there were no lesions. The thorax is symmetric. The costal angle we will observe as well. His ribs do appear to be downward sloping with no abnormalities. Next, we will watch the patient breathe. And there are regular and symmetric breaths. Next, we will auscultate his lungs. Sir, if you could sit up for me just a little bit. That's good. All breath sounds are clear on the anterior side. Next, we'll go ahead and examine, listen for the heart. Heart sounds are heard to be regular and even. S1 and S2s present. No murmurs or bruits heard on auscultation. Next, we will perform tactile fremitus. Sir, as I move my hands throughout your chest, I want you to say 99 with each movement. Or go ahead and sit up for me. Thank you.
99, 99, 99, 99, 99, 99, 99, 99.
Does appear to be symmetric vibrations throughout the anterior chest. We'll go ahead and examine for any lumps or masses. Sir, if you'll raise your arm. Any tenderness?
No.
Any tenderness?
No.
Next, we will examine the posterior lung fields. Sir, if you could position to the side so we can listen to your lungs. Thank you. And as I move my stethoscope, please take a good deep breath. Posterior lung fields are clear to auscultation, and while we're examining the patient's back, we'll notice that both of his scapulas are evenly placed with no abnormalities. Any tenderness in the back of your chest, sir?
No.
Next, we'll examine for symmetric excursion of the lungs. If you'll turn just a little bit more so we can catch the camera. Thank you. Take a good deep breath for me. Good. There are equal and symmetric chest expansions when the patient breathes. We'll go ahead and examine for CVA tenderness. Any tenderness, sir?
No.
We did not auscultate any adventitious lung sounds. We'll go ahead and do tactile frematist on the posterior of the patient's chest. Sir, as I move throughout the back of your chest, if you'll say 99 for me.
99, 99, 99, 99, 99, 99.
With symmetric vibrations when we examine for tactile frematist on the patient's posterior chest. Next, we'll check for resonance as we move throughout the patient's chest area. Good. You can sit back, sir. There was resonance in all lung fields. Now we percuss the anterior of the patient's chest. There was resonance in all lung fields on the anterior of the patient's chest. Next, we'll examine the patient's extremities, starting with the upper extremities. Sir, if you'll be able to lean up just a little bit for me. Any tenderness?
No.
Stroke's coming under. Okay. If you'll lift this arm out for me, or you can do both at the same time if you're able to. And if you'll bend your arms up for me, and straight out, down, and can you move them behind you? Good. And can you do a circle for me? Okay, thank you. Range of motion is intact. No crepitus heard with range of motion. No tenderness with either. When we're examining the upper half of the patient, we'll notice that his breasts are symmetrical with even placement. We'll go ahead and move to the abdomen now. Sir, if you'll lean back for this examination. The first thing we'll do examining the abdomen is we'll notice the symmetric appearance of the abdomen. He is of average build. There is no distension noted on the abdomen. The skin coloration, the skin is pink, intact. There is no lesions. The patient has no abdominal complaints, no hernias. We'll next listen for bowel sounds. There are bowel sounds present and active in all four quadrants of the patient's abdomens. We'll next auscultate over the aortic valve. There are no bruits heard with the vascular sounds. We'll next percuss the patient's abdomen. their resonance present throughout the patient's abdomen. Next, we'll examine for the liver and the spleen. Regarding the liver, the lower region of the liver is palpable. Next, we'll examine for the spleen. And the patient's spleen is not palpable. Next, we'll perform palpations on the patient's abdomen. We'll start with light palpation first. Sir, you tell me if there's any tenderness. And with deep palpation. Any tenderness?
No.
Upon palpation of the abdomen, normal, symmetric. Next, we'll move along to the inguinal area. We'll feel for the femoral pulses. This would best be done with the patient in a patient gown. Femoral pulse is present of regular rate and rhythm, is even bilaterally. No inguinal hernias noted. We'll check for inguinal nodes. You tell me if there's any tenderness. No nodes or tenderness felt upon examination. Next, we'll move to the patient's lower extremities. Sir, if you uncross your legs for us. The patient's lower extremities appear even, symmetrical. We'll examine for swelling, edema, or atrophy. There is no swelling noted in the patient's legs. Next, we'll check for range of motion and pulses. We can go ahead and recline for this part of the exam. Okay. If you can lift this leg in the air for me, and can you move it towards me, and then across your other leg, and then can you bend your knee up towards your chest? Okay, you can relax it. Then we'll start with the next leg. Can you go ahead and lift it up for me? Move it away, move it towards me, and then go ahead and bend your knee up. Okay, you can relax your legs. Any tenderness noted?
No.
No tenderness noted when examining for range of motion in the lower extremities. No swelling is noted in the patient's joints. Excuse me. Next, we'll check for pulses in the lower extremities. Okay. Sir, if you can please take your shoes off for me. Now you can return to a reclined position. And we'll examine lower pulses, posterior tibia and dorsus polaris. Next, we'll examine range of motion in the ankles and the toes. Sir, if you could lift your leg slightly. Are you able to move your ankle? And can you flex your foot forward and then backwards? And then we'll do it with the next one. No edema noted in the toes or the ankle area. No crepitus heard with range of motion. Next, we'll move along to the neurologic part of the exam and test for sensations. Sir, you can go ahead and sit up. Okay. And we have a hard and a soft object that we're going to check for sensation. Sir, as I touch these to different areas of your body, you tell me if it's soft or sharp.
Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp.
Sensations are equal and appropriate in both the face, arms, hands, legs, and feet. Next, we'll examine for stereogenesis. Sir, if you'll hold your arms out and close your eyes, I'm going to place the object in your hand, and if you can identify the object for me, go ahead and close your eyes. And you can use both hands to feel the object.
Paper clip.
Good. Paper clip. With your eyes closed, here's the second item.
Coin.
Good. The coin. The patient is able to identify both objects, appropriately. Next, we'll examine for patient sense. If you'll go ahead and stand for me. And then go ahead and close your eyes and just continue to stand where you are if you're able. Okay. There is no swaying or deviation noted to the patient's posture. Next, we'll go ahead and continue to examine the last part of the lower extremities. If you can lift your knees for me and stand on one leg. Good. Now we'll switch to the next one. If you can stand on one leg for me. Good. Okay. Now you can go ahead and sit back. Next, we'll examine for cerebellum functioning with the finger to nose test. Sir, if you could take your hand and touch your pointer finger to your nose and then touch my hand. Okay, continue. Okay. Good. Good. Functioning is intact. Next, we'll check heel to shin. Sir, if you can take one heel and slide down the opposite shin. Good. And now the opposite leg for me. Perfect. Heel moves in a straight line down each shin. Next, we'll move along to check deep tendon reflexes. hold your hand here and just let your weight go dead, and we'll examine your reflexes. We'll do the same on this side. Okay. And just let your arm go. There we go. Okay, we'll continue on to the next. Let your arm go in. Okay. And we'll examine deep tendon reflexes in the lower extremities. Just straighten your legs for me. All deep tendon reflexes are present, plus 2. We'll go ahead and examine for Babinski's reflex. Sir, if you can go ahead and recline once more. Good. Babinski reflex is absent. Okay, you can go ahead and lean forward for me in a sitting position. Going back to examining the patient's skin. When we examined it earlier, we noticed on the hands and the rest of the body, skin was intact. Nails appear clean, rounded, even, and in place on each finger. The skin is noted to be smooth and firm with even surface, good turgor. And we'll move along to the patient's hearing test. In a clinical setting, this would be the Weber and Renee, but in the home setting, we'll refer to the whisper test. Sir, I'm going to whisper a word and you repeat it for me.
Birthday. Truck.
The patient passes the whisper test with good hearing noted on both sides. In a clinical setting, we would continue on to check for the male genitalia and reproductive system. For the sake of this assignment and due to patient privacy, we will exempt that part of the exam. Sir, I'd like to thank you for your participation in this assessment. Thank you, and have a good day.